The Affordable Care Act's health insurance marketplace one day closer to going online. Tonight, new information on what these plans are looking like here in Illinois. ABC News Channel 20's Kimberly Howard live in studio. Kimberly, Governor Quinn released some numbers today, right?
He did, Vince, but he only released a few vague examples. And as the clock keeps ticking until the health insurance marketplace goes online, some are wondering, why isn't all of this information out there?
I think it's time for us to have some kind of insurance for people that can't afford it.
And the options for those people are just 1 week away. While the ins and outs of the Affordable Care Act Health Insurance Exchange have not been released in their entirety, at least not in our state, we have some insight on what plans in Illinois could look like. Here's an example. The monthly rate for the lowest cost plan for a 25-year-old non-smoker in Chicago would be $120.
Unfortunately, that's still twice what that same young man could buy insurance for today in the private market.
But that would be bare bones coverage. Under the Affordable Care Act, all plans provide hospitalization, ambulance, mental health, and maternity services, just to name a few.
Everybody's so busy trying to jump on it, trying to make the negative end of it work, that they don't worry about the positive end.
Like the rates announced by Governor Quinn are 25% lower than estimates from the federal government. And many Illinoisans living in poverty who aren't offered affordable health care through their jobs may be eligible for subsidies. Another example, a single 30-year-old living in Chicago and making $23,000 a year could bring his or her monthly premium down to $69. But what about options?
My concern is that under the Obamacare exchange, these health insurance providers will only have a very limited number of doctors and hospitals that these patients can go to.
There are also concerns about security, since the exchanges must compile sensitive information about those who use it.
It's got kinks, everything has kinks in it. Give it a couple of years, let work the kinks out, see how much it does help the people that really need the help, you know.
All in all, Quinn says 95% of Illinoisans will have access to 34 different plans under the exchange, and that exchange, of course, goes online October 1st. That's exactly 1 week from today. Vince?
Thank you, Kimberly, for a look at all the information Governor Quinn sent out today about health insurance plans under the Affordable Care Act in Illinois. All you have to do is log on to our website, WICS.com, and click on Web Watch.